Welcome to Facial Plastics Friday. Dr. Brace here. We're in the OR today for this edition, and we've just finished our series on complex rhinoplasty. Today I wanted to dive into a little bit of facelift, and so the first thing I want to talk about this week is what is a mini lift and why don't I do it or offer it here at Guelph Facial Plastics. And I've talked about this in the past. The term mini lift is not a standardized term, and so that means something different to every surgeon. Some people describe that as a short scar facelift, where you make a little scar in front of the ear and just lift up from here. Some people describe it as doing liposuction or profound underneath the neck, or a combination of those things, and there's lots of different mini lifts that are out there. But essentially what a mini lift is a miniature scar with a miniature result, and I don't know very many patients who would be happy with that. And so if you have a hanging jowl, if you have a hanging platysma, if you have a hanging mid-face and a deep nasolabial fold, a mini lift is not really going to correct much of that. It might make it a mini amount better. And if you're going to be going under a general anesthetic and having a full surgical procedure and you wake up and 50% of what you didn't like is still there, most people are going to be upset by that. And so a mini lift is a mini result, and what we do at Guelph Facial Plastics, what I do, is a deep plane facelift for nearly everybody. A deep plane facelift treats the face and the neck as one unit because it is one unit. The platysma muscle right here, the one from your collarbone that comes up over your jaw, gives you the band right here. That continues in your face as what we call the SMAS, the superficial musculoaponeurotic system. So the SMAS and the platysma are all one. If you just do a mini facelift and do this, you'll still have hanging platysma. If you just do a little neck lift, you'll still have a jowl and a hanging face. And so to treat this properly, to rejuvenate somebody's face in a natural way that doesn't create an asymmetry or an unnatural look, a deep plane facelift releases the ligaments that attach the SMAS to the face and the platysma in the neck, repositions everything up, and allows that to heal with a very minimal scar because there's no tension. It's a repositioning surgery. It's not a tension-based surgery where we try to pull things really tight. And so what's a mini lift? Mini result, big dissatisfaction. What's a deep plane facelift? What's a proper repositioning of the facial tissues that have dropped, which gives you a natural and longer lasting result. And those are the differences. I've said before, the term mini lift or facelift is sometimes like race car. Race car could mean a Maserati. Race car could mean a Hyundai. It's different to every person, but a deep plane facelift is actually a described standard term, and that's where we release and reposition. That's what I think gives the best result, the most natural result, the longest lasting result. So that's what we do here at Guelph Facial Plastics. If you have any questions about facial rejuvenation surgery, just send them our way, and everybody have a great weekend.